All right. Dr. Negar Shekarabi, welcome to Green Pill. First question, will you take the green pill?
I
All right, awesome. So, Dr. Shekarabi is a workplace well-being specialist, licensed clinical psychologist. She's also the founder of Wellversity. Wellversity is dedicated to the mental health and well-being of employees across universities, corporations, nonprofits, and other large orgs. So that's her consulting business. At the same time, she's at UC Irvine, where she leads mental health and being for 30,000 employees. That's right, 30,000 employees, faculty, staff. So at UC Irvine, she serves as the quarterback or sort of the distributor for everything when it comes to mental health. So that's training, that's staff, that's one-on-one, people seeking counseling and psychology. Super excited to have you here today, Negar, because you have such responsibility at a big university system and you've done such cool consulting. So I think those listening who own a company, even have a team, who are involved in the team, are going to learn a lot today about how to keep their team sharp, but more importantly, safe and okay. Yeah, what would you like to start with? How did you get on this journey on mental health?
Yeah, I think that I'm one of maybe those rare few that pretty early on in life knew I wanted to be a psychologist. So I can't remember a time where I didn't want to go in that route, but I really did start with the clinical psychology route. I did a traditional doctoral degree
Mm-hmm.
and went directly into clinical work. So primarily though working in higher ed. So I was initially early in my career working on college campuses at counseling centers with our student populations, doing a one-on-one counseling 20, 25 hours a week, session after session.
Mm-hmm.
And working with that population has always been amazing. And my colleagues that are still in that realm will attest to that. I think over time, I also started through the counseling center world getting pulled into doing more and more trainings and workshops with our faculty and really started to find a nice niche there in terms of talking to faculty and staff, not just about the mental health of their students, but organically through those training experiences, their own mental health concerns, their own well-being concerns was really getting infused into the conversation. And our university, I at that time was really hearing from faculty in particular a lot about how they felt like they needed more resources for themselves. We historically at UCI, like a lot of institutions of higher ed, have an employee assistance program. We have medical benefits, and all of those things are great mental health resources. But I think navigating them is often very confusing and tricky for employees in higher education. It's hard to find information about the resources. How do I get connected? What are my benefits? And so I think things just really came together, and the university created a position where a brand new position where you would be tasked with one, helping faculty and staff navigate all of their resources, be able to do some on-site consultation and counseling, respond to crisis situations that involve employees, and then of course do training and education. So at that point in my career, I had been working so much with faculty already. I really jumped on the opportunity to get in this role and was able to be the inaugural coordinator of this office and really over the last 7 years and build it out and make it what it is today.
And we'll certainly get into what it is today because you have a broad remit, and I know folks out there listening, from crisis to something happening on campus or a professor student interaction or just a staff member who's going through it with the crisis in their own life, all the way through training, all the way through mental health first aid, which you're the first person that made me aware of it. And then I was in Tanzania last month, and turns out that two of the ladies who I volunteered with did a mental health first aid training and now lead it for their community, and they went to London just to learn that. So kind of interesting synchronicity there. With you wanting to be a psychologist, if we go all the way back
Mhm.
your whole life, what prompted that?
Yeah.
What prompted that?
Yeah, I think the way over the years I've always really thought about it is my family immigrated here from Iran when I was 4. I'm the youngest in my family. And so as you can imagine, developmentally, 4 is a pretty interesting age to be leaving one country and going to another and not under unstressful conditions, right? It was during the Iran-Iraq War. There was quite a lot going on there that my parents were part of a huge wave of folks who immigrated from Iran at that time to Europe and the United States. So I think in a lot of ways when I'm trying to organize my mind around how I gravitated in that direction, I've always historically certainly been an observer. There was a lot of stress and anxiety happening
Mm-hmm.
around me at a young age, but I probably understood less about what's happening and why it's happening because of my age. And so I did really shift into a quiet observer role. And I think when you do that, when you listen more and you talk less, you naturally notice things that other people don't. And so I think that I became really sensitive to that, just noticing things, noticing patterns, being curious about why people were doing certain things or acting certain ways. And so I always was very interested in that and understanding people and being curious and connecting the dots. I don't think that it really formed for me, really, my understanding of how that all led me to this career until later in my life and doing my own work and my own psychotherapy, and uncovering some of my own, I think, like racial trauma that I experienced as a young immigrant here with an unusual name, right, in elementary school, and having to navigate all of that. And how, in a lot of ways, I also used my people skills, my soft skills, my likability, my ability to make people feel comfortable, the social currency to help me navigate some of that racial trauma and otherness that I was feeling, right? So if I'm really low needs and I'm always okay with everything and I go with the flow, then I can feel like everybody else because I felt so much not like everybody else at a really young age. I don't think that I think I've navigated all these things as just personality traits or the way that I am until later in life, and when I really dug further into it and understood some of these things more as my own trauma response. And I think for me, it points out how when we are navigating things that are traumatic to us, the outcome is not always negative, right? It led me to in a really cool direction in a career I love, doing great things. And generally, I think things that are helpful to other people, but it still has been really helpful for me to understand where it all came from, even if it didn't lead me in a direction that was necessarily problematic or difficult.
Do you find yourself becoming more assertive over time?
I think I'm over 40 now. So once you hit
I
40,
know the Shah was deposed in 1981. I
right,
figured.
yeah. So I think as I've gotten a bit older, a lot of my life journey is about undoing some of that, right? So learning how I can take up space, that my likability is not actually attached to me being low needs. That's just something 4-year-old me convinced myself of, right? It's a journey, but I think, and I can honestly say I've done the bulk of it in the last 5 years, really, of my
Wow.
life. Yeah.
Even though you've been in school to become a counselor, or you've been a counselor yourself since the mid
Yeah.
2000s, right? But the last 5 years, so that gives people some perspective, right? Because I love to see the expert sitting in the chair and saying, "Hey, I just figured it out recently, and it's still a journey and a work in progress." So, thanks for your candor there. I didn't know if we would get that deep with it. Trauma of being an immigrant, racialization of funny name, maybe funny accent, your family definitely being way different than maybe the surrounding families. Where'd you grow up, by the way?
Orange County
Orange
primarily,
County.
and I'm still there in Orange County. So I think it's really interesting, as California certainly being a very diverse place. Orange County is diverse, but probably maybe less diverse than other parts of California. But I think my experience being from Iran, I very much experienced it as I was the only person, right, in all of elementary school with my background. And it may not have been 100% true, but that was my experience of it. And that sort of has huge ramifications on developmentally for you to be that singularly unique as a child, or feel or believe that you are.
Did you have older siblings who had just similar experiences but were older and maybe handled it differently?
Yeah,
How
I
did
have
they
one older
manage?
sibling. Yeah, she's 7 years older though. So
Okay.
by the time we immigrated, she was already like junior high age. So I think she definitely, certainly also had to navigate it, but it was a bit different, right? Developmentally, she was in a very different place. And also she had a different experience in terms of she has much more memories about Iran. She had school years there, friendships there that she left behind. So that's a whole other type of grieving that she probably in her process had to do that wasn't as much a part of mine. I hadn't even gone to school yet, right? I only had
Right.
been in the United States. So for me, it was more about, I think for me, it was a lot more focused on my identity. And whereas for my sister, it was identity and relationships and social connections as well.
And I want to bring that back in a second to UC Irvine and your current work. I will ask, did your parents adjust as well? And being a first generation immigrant myself, you weren't born here, I was, but being the only Russian really for miles, I think, or Ukrainian, I was called Sputnik when I was growing up, and that was always my nickname. And I didn't really mind it, but again, it was some othering, and I definitely felt that. And it's different, me being white. And going with that thread, Let's take it to UC Irvine. Do you see in your counseling days in the earlier years when you were really specifically seeing students and then you transition more towards faculty and training, do you have a large immigrant population at the university?
We do, yeah. Give or take, approximately 50% of our student population identifies as Asian or Pacific Islander.
Wow. And do you build that in? Did you build that in at the time? And how'd you
Yeah,
do it? Yeah. Do
I
people
think,
come with that, or did you have to educate them and say, hey, maybe what you're feeling is
yeah.
blank?
I think so. When I started working in the counseling centers with college age students, it was 2008 and 9 when I first
Hmm.
started. And so when I think about those students that were undergrad students then versus the ones that were undergrad students in 2016, their level of consciousness and awareness about their own experiences around their race or their identity has had grown leaps and bounds. So I would say I probably in the earlier years might have found myself maybe suggesting or providing that framework as a way or a lens to maybe look at some of their troubles through more often. And in those later years that I was there, these students get it. They had already done the work that I'm doing now in my 40s.
Hmm.
They're already there. And so they're much more clear on what parts of their experience is related to oppression, is related to racial discrimination, is related to all of those elements of their identity. And they come often into counseling wanting to look at things through that lens. And so it's really was fantastic to see that shift, that cultural shift happen through the lens of these students, through 18 to 24-year-olds, right? And how different their sense of consciousness was just in a matter of 7 to 8 years.
And when you say they did the work that you did in your like early 40s, late 30s, they did the work already. They had the concepts, right? And they had the framework, and it was right leaps and bounds 2008 to 2016. But did they actually have therapy growing up, generally speaking, or were they more fluent
Mm-hmm.
in what was going? Like
I think,
that's what I
yeah,
wonder. Yeah.
yeah, I think that that Western psychology had by that point really infused itself into our narrative. So there's some of that in some ways our culture is increasingly become psychologized in some ways, but increasingly we see more and more college students come to college already having had some psychotherapy experience in high school. We're seeing that more often. I don't know the statistics
No, yeah, I don't
grown.
know if anybody does. Yeah.
Yeah, it's definitely grown that it's more often likely that their experience in therapy in college is not their first. And part of that is because their parents' generation has been more willing to get their kids connected to counseling in childhood than, for example, my parents' generation.
That's a good juxtaposition because right that your parents' generation counseling wasn't common, and it's well if there's something really wrong, right? Whereas our generation, my generation, and I'm 31, so not so far from you, it's more preventative, it's prophylactic, it's holistic, it's part of it. And could you tell us a bit more, especially folks listening in the university or the large organization world, more demographic profiles of UC Irvine? 30,000 staff members across the university and the medical center, student population 50% AAPI. Are they coming from, if you had to put them on a socioeconomic bandwidth, what's that look like, just so folks know?
I think it's a pretty wide range socioeconomically. It's generally considered a commuter school, so we do have many of our student population living on campus, but
Hmm.
also lots of commuters as well from all over Southern California, but also folks, of course, that have relocated from other states. And UC Irvine is one of a few of the campuses in the UC system that also has an affiliated medical training hospital connected to it. So we're that 30,000 employees is UC Irvine and Irvine Health together combined.
Hmm.
So we're talking about this whole other world as well of healthcare professionals that are often also tapped into the training and education of future healthcare professionals. So they're working in the hospital, but they're also connected in some way to the School of Medicine or the School of Nursing or Pharmaceutical Sciences and training new professionals as well. And so that's its own little world of academic medicine as well. I think historically, UCI and UCI Health have functioned really independently. And over the last few years, there is a real effort to make more of a connection and see it more as an enterprise and see that the needs of the employees across the board, across the whole system be addressed and not silo as much.
Hmm.
And so there's more efforts on our leadership level to have cross collaboration campus and UCI Health more often. My role is one example of that. I'm one of the roles on campus that's considered an enterprise-wide role. So
Hmm.
anyone who's an employee of UCI or UCI Health could use my office I'm not location specific. And there's a few other examples as well. I think UCI is also in the last few years really stepping into integrative health a great deal. We have our College of Health Sciences establishing, and we also have our Samuel A. Office of Integrative Health as well, which is a clinic and provides all kinds of integrative health services. And so we're really doing some really cutting edge stuff. And we also were, I think, interestingly connected to our discussion about wellness and mental health. We are one of the first campuses who joined the Okanagan Charter, which is a charter that several universities have joined, which is really about looking at wellness at a university or higher education institution holistically and looking at all elements of wellness, mental health, physical health, environmental health, all of these things, and making a commitment to centering wellness. So we were one of the first handful of campuses who signed on to the Okanagan Charter.
And so touching, I guess you have such diverse staff groups and such diverse student body. Students are students, but medical students are their own cup of tea, which they would know are they have a tough life. When it comes to staff, given that you're enterprise-wide, you're responsible for both professors, both janitorial, both doctors probably, and clinicians. And it seems like there's a few initiatives. It seems that health is important and wellness is important across UCI. What challenges have you seen with the implementation across such a big organization with merging? And what wins have you seen in your time? If you give us a couple on each, yeah.
Sure. Yeah, I think that the challenge is really related to our size. UCI is massive. It's its own like city, right? In some ways. And what I think happens is that there's a lot of siloing, unfortunately, that will happen. There's lots of different entities or groups, whether it's in HR or in an academic department or in academic personnel that might have a stake in doing some programming or offering some services around wellness and well-being. And we will not know about one another and we'll be functioning in silos and recreating the wheel, often unnecessarily, when we could have been collaborating or working together or making something even bigger or better. So there's often efforts to be able to do a bit of an inventory of who's doing what where and bringing folks together. But I think every handful of years we have to do that again, right? Because folks change, new initiatives come through, grant funding comes in for something, someone decides to do a wellness initiative around that. The other offices don't know anything about it, right? We have to keep at that because it's so huge. And so that's a big challenge. And then I think historically the other main challenge that we've had is faculty in particular have always felt like a little bit of a conundrum. Like, how do we catch their attention? Our staff who are non-academic are a little bit easier when we have wellness initiatives or programs or trainings. They tend by and large to be the majority of our attendance, and faculty is a little bit harder to reach. So really trying to understand what's the magic pill, so to speak, to get the interest of faculty. They certainly are involved in our trainings and our programs, but just at a lower rate. And so really understanding, and my guess is that part of why it's difficult is that faculty in each school or each department all have a different culture and different expectations. And these sort of one size fits all initiatives don't always quite resonate for them.
I'll let you get to wins in a second. Yeah. Siloing, I think most folks listening understand, and it's probably me being a process guy just wants to draw a big chart and map everybody on the billboard, and you probably too. Though measuring success, I think, is more interesting. And me having worked in corporate wellness I had my own corporate wellness business for a bunch of years. I've sold a couple other ones. It is tough to measure success, and yet I'm curious how you do it.
I think it's really tough to measure success, right? Because how do we measure a crisis that didn't happen? It's really difficult, especially when we're specifically looking at mental health, because often roles like mine really are often also about risk management. And so if things are going well, how do we know it's because of the things that we're doing or just because things are going well? So some of the ways I think and it's related actually to one of the wins is, for example, rolling out our mental health first aid program. So we in 2021 decided to bring mental health first aid onto our campus to be our main core mental health training. And we've been able over the last 2 years to train over 500 of our faculty and staff to become certified mental health first aiders. And I think my sense is that's a pretty good critical mass number of people to start seeing some culture change and shift. And so one of the things that for us feels like a good measurement is this continued high level of interest in the trainings. Every time we make them available, they fill up very quickly. They're very popular. And so that getting that sense that there's still that interest, there's still that need, folks are looking forward to the next training has been one measurement for us that feels like, okay, this is something, we're on the right track.
And so, what for folks listening? What is mental health first aid? It was a new
Sure.
concept when you told me about it too.
Mental health first aid is an internationally recognized mental health first aid training program. It was developed in Australia, actually. And so there's an Australian version and there's a European version, and we have the US version. It's a training program that teaches its participants how to respond to mental health crises and substance abuse crises, how to talk to other people and get them connected to help and support, professional help and support. It's really a full day certification course that folks would have to go through, just like CPR, and they become a mental health first aider at the end of. And to really bring a training like that to your campus, as you can imagine, could be really cost intensive to keep going to the National Council of Mental Wellbeing and bringing an instructor onto your campus. So what we decided to do was just really invest on the front end financially at UCI and have our own faculty and staff trained as instructors. So we have our own 21 of our faculty and staff who have other full-time jobs, but who just had a passion and said, I want to be an instructor, certified as instructors. And so now they are the ones that teach our courses to the 500 others who have taken the course. So we schedule them a couple times a month, and these folks volunteer extra time to the course and get other folks certified.
It's one. It sounds like 1.5% of the population is certified, which maybe to the layperson doesn't sound like much, but that's a lot in a big organization, because you can look at how that spreads out into the silo. Is there any way you take that group and almost give them a sense of belonging, a sense of responsibility, a sense of culture? And I know culture comes from the top a lot. And so how do you manifest or instantiate this sense of responsibility or sense of things are going to be okay with that group? Because it seems like those are your evangelists. I can almost see you I don't know about a maestro, but those are your evangelists. So how do you do that?
So I think it's sort of 2 layers. So we have our certified instructors as one group, and the other folks, the other 500 who just get the certification. So our instructors, we really have created a cohort for them. We meet quarterly. They get resources. We brainstorm together about things they've run into in teaching the courses, strategies. So we try to create a professional development opportunity for them that's ongoing, opportunities to present at conferences, and we keep that cohort together. And every few years, when our pool dwindles because there's some turnover, we'll do another instructor training and we'll add to the group. And then the 500 and the growing 500 that will continue to get certified. Part of mental health first aid really drives home that within the curriculum of the course really drives home this message of, like, you are now a certified first aider, like wearing that as a badge. So we actually have created UCI Health certified mental health first aider badges for folks that they get once they've completed the course. So they don't just get the certificate that they keep in their office and nobody sees. They can add something to their signature line. They can have something that they can have forward facing to let other people know, I'm certified in something a little bit extra, and I feel comfortable being identified as such, so that if there is a crisis situation and someone is struggling, you can come to me. I have an extra set of skills. I've put in the time and the effort to get those skills, and I'm passionate about it. So we encourage our first aiders to do that, and to also inform their departments if they're comfortable that they've now been certified in mental health first aid, so that departments can decide in their own department level plans around crises if they want to plug this person in in a certain way, maybe as a peer counselor or something like that.
And it almost reminds me of when I was a kid, even corporate New York, the fire drills that we would run, there'd always be someone on each floor that would be somehow trained by the fire department to lead people in one way or another. And I guess you can't measure crises avoided, although I'm sure you wish you could, because you'd be probably getting paid triple, although I'm sure they love you there. Man, that's a tough one with you. And I don't want to be too dark and morbid, but you see the shootings, you see the crises on campus seemingly occurring more. I'm not sure the data on that. How do the mental health first aiders act as a safety blanket for crises on campus? How are they instructed in their programming? And then is there anything you or your team or the folks you work with layer on top to really forestall, prevent, interrupt crises?
Yeah, I think really that's the goal, right, of having the mental health first aid training is the program really drives home this idea of early intervention being so important. So it's really certainly there is components, modules in the training that are about responding to a crisis situation, but it's also very heavy on how do we intervene with each other early at those earliest signs of distress or the early signs that someone is struggling, because we know that the earlier someone gets connected to help or support, we're more likely to prevent a crisis situation. So there's a lot of their training is focused on recognizing the early signs and symptoms of mental health struggles, and then providing them with a 5-step model of how to approach and how to do non-judgmental listening and how to talk about resources and be knowledgeable in those resources, know the difference between a psychologist and a psychiatrist and a social worker, right? To be able to have that language and then be really well versed in what are your on-campus resources, what are the off-campus resources, and know in a nuanced way to how to talk to folks about getting connected to those things. And then we do layer on top quite a bit. We've created some resources specific, for example, to crisis situations. So it's a checklist essentially for managers and supervisors.
Mm-hmm.
If a crisis has happened, whether it's an on-site crisis, like at the medical center, we've lost a patient, unfortunately, and it's impacting the treatment team, or a crisis like our coworker has suddenly passed away over the weekend, and now we're coming in Monday and we have to tell everyone. Those types of crises, giving a checklist for managers and supervisors to make sure they're attending to the well-being of everyone and taking all the right steps. And we distribute that out as well so that managers and supervisors can feel like I'm not just talking to HR and doing what I'm supposed to do on the logistics end. I'm also checking in with folks individually, talking to them about the employee assistance program and Negar's office, maybe bringing them in for a debrief session with everybody, and all of those extra steps we'd really love folks to make sure that they're doing after a crisis.
And that's good. Checklist. I don't know if you read Checklist Manifesto. Have you heard of that one? But it's a book all about checklists. Atul Gawande, public intellectual, and it's pilots use checklists. Experts in every domain use checklists. Surgeons, crisis response teams use checklists. And when it comes to the 30,000 employees, there's one Negar, so we could see it that way. But when someone comes through your door, you act as a traffic signal in a way, maybe like an evaluation, and it's either a red, a yellow, a green, or that way, this way. You're pointing, I know we discussed, to insurance-based resources. And of course, I'm sure you endeavor to make it super clear on the website and in the user experience how to access these EAP programs and insurance resources. Does this university employ any mental health counselors for staff, or is it funneled through insurance? And then on the student side, what is the preponderance of such like resources, and how are they distributed?
Yeah, so on the student side at UCI and all of our UC campuses throughout the system, is an on-site counseling center. Our counseling center is very well staffed in some ways. I think we could always use more. It's never enough, but we have approximately 20 psychologists on staff and psychiatry on staff. And so it's all in-house, and all students get free counseling as long as they're full-time registered students there at the counseling center. It's short-term therapy. So if students need longer-term support, then the counseling center staff will work to get them connected through their insurance for the longer term. On our campus in particular, we don't have an equivalent to that counseling center model on the employee side. Some of our UC campuses do. San Diego, LA have on-site employee assistance programs where they have a small staff of counselors, similar to a counseling center, where employees can get those same sort of short-term therapy services. And then the other, I think, half of our UC campuses, UCI is one of them, we have external employee assistance programs. So we have partnered with a third-party vendor. Ours here at UCI is CompPsych Guidance Resources. We've been with them for many years, and ours would look a little bit different. If folks want to connect to that free counseling through the employee assistance program, they'd have to reach out to the employee assistance program, who would do 24 hours a day. They're available, but would do a phone consultation and then connect them for their sessions to a live therapist. Part of the reason why my office came to be was some desire to have something in between, sort of this sense of maybe we're okay not having an on-site counseling center like the other campuses do, but it feels like we need something between that and calling the EAP. So the creation of my office was in part to help fill that gap. There are some situations where calling the phone number and getting connected to the EAP counselor isn't sufficient. We need maybe someone on site. Crisis situations is a really good example. Individuals who are really struggling with following through with that process of connecting to the EAP, because it does require some degree of being able to engage in those self-help behaviors, right? I
Totally.
recognize I need help. I'm going to call the number. So my office in part was designed to help people bridge to those resources. And then, of course, the insurance plans, which I think my sense with the insurance plans is, as you can imagine, universities in higher ed, employees in universities in higher ed, by and large, for the most part, are very educated, capable people. And it's still a challenge to navigate insurance. It's so confusing for folks. And it is, maybe not by design. I don't want to be that cynical, but it's really hard for folks to navigate. What are my benefits? How do I find an in-network provider? And so even on the insurance end, I think folks have needed someone on site, on campus, to help them figure that out and get connected.
So yeah, your role across this crisis, near-term crises, guidance towards insurance resources or EAP resources, and then longer-term trainings, and then overseeing the mental health first aid programs and similar programs like it. And so it might be a good time to transition towards what you do for other organizations that it might be at different stages of development relative to UC Irvine. And I know there's an Irvine company.
So I've done some consulting. So Wellversity is on my own, my consulting.
Yeah, let's talk about it.
Doing similar work. I think part of, for me, was recognizing UCI as an example is resourced, right? They can create a position like this and have this kind of work done for them on campus. But there might be other companies that might need this type of service a la carte and might need pieces of it. And so I developed Wellversity to be able to provide on a consultancy basis these same types of resources, consultations to other companies who might not have something in-house similar to what I do at UCI. So I've worked with, for example, James Madison University in Virginia to do some training with their faculty on faculty mental health, Cal State Fullerton as well, to do some training with their staff at one of their staff conventions on employee mental health. Done some consulting with Irvine Company around crisis, this sort of idea of a crisis checklist, and creating that for their staff. And so these types of services, as they've come to me, are typically by request, and we'll look at what their needs are. I can provide a proposal of what I'd be able to offer them. And then I think the nice part is companies can decide, yes, I have all of that, or no, I just need this one service, and be really flexible in that way and getting them that additional resource that they might need. Often it's in the form of a training. So far has been my experience with Wellversity, folks just needing maybe a lens of workplace mental health expert to come in and talk on a certain topic to help them springboard some sort of initiative or something they want to get really focused on in their company.
And it might be revolving out of a crisis that happened, or employee complaints, or org change, or whatever. So it's usually a catalyst, I imagine, that brings you in. Where does that budget come from for people to fund both a workshop as well as building out a checklist, as well as building out, maybe you could supervise the mental health first aid creation at another in your consulting role? Where does that budget typically come from? Is it from the campus, from the employee side of things? Is it actually, I don't know. Where does it come from?
I think it would be most often coming through human resources, but on the employee side, certainly. Some campuses have wellness funds set aside to do things like this for extra wellness and well-being initiatives. And I would imagine that those budgets would usually probably be with either HR or their academic personnel, which is like the HR of the academic side for the most part. And then very infrequently, but I would imagine sometimes at some institutions, they might be using budget from their student side if they feel like this training for our faculty at the end of the day goes to benefit our students' mental health as well. So if our faculty are better trained, they can support our students better. I think they can make that justification to use funds that are coming from the student side as well.
I was really drawing that thread the whole time. If you've trained 500 faculty or whatever staff, and not all of them are faculty, it is going to downstream onto the students. Right. There's just no doubt about it. To me, that's an easy thread to pull. Maybe as we finish up, we could give a few recommendations for folks who have teams, whether large or small, who want to see mental health more at the forefront, like that initiative you mentioned, where it's front and center, maybe it's measured, it's important, it's talked about. It's near and dear to my heart, of course. And having started my yoga company in 2014, when I saw everyone was crouched over their desk, eating terrible food, working all day, and I said, wait, what? This is how people work? And so I quit and started a corporate wellness company. Give me like 3 or 4 that you really recommend when people are trying to institute culture and process.
So I think one of the first things that comes to my mind is really getting a good sense of what does communication around mental health and being in your organization or on your team look like, and is it really open communication? Are folks encouraged to be able to talk about mental health or their mental health, whether that's done through encouragement or modeling by leaders? It can be really powerful, because we can't know if someone's struggling if it's like a hidden injury very often when folks are struggling in terms of their mental health.
How does a leader do that? Yeah.
I think that ability to be transparent about your own struggles or what you might be struggling with can go a really long way. But I think also just creating really consistent check-in opportunities. I think supervisors often meet with their staff to check in, but are not necessarily, and I think they hope that if something's wrong or they're struggling, they'll tell me, but are not necessarily always explicitly asking about how people are actually doing in terms of their well-being or their mental health. And so I think that can be really a great form of modeling. That's fair game, that we spend so much time together here at work, and work is going to impact our mental health at home, and home is going to impact our mental health at work. It's all really part of the same picture. I think there can be some hesitancy, I think, sometimes to ask those questions for fear that we are probing folks too much or asking them to talk about personal things. But I think one of the really great things that you get from something like a mental health first aid training is how you can really walk that line well, showing care and interest without crossing into asking folks questions they don't want to answer, really keeping that general. So I think that's communication is one piece of it, and looking at what's the culture of communication on my team or in my organization around that. Also, do you have resources? Of course, is the first step. But assuming you do, assuming you have mental health resources of some sort, are they easy to find? Do people know what they are, and can they find them in a crisis situation relatively easily? I think that's really important, of taking a little bit of a survey of, if I'm a typical employee in this organization and I need mental health support, would I be able within a few minutes to find it? Right?
Can I ask you, like, you can't take your participant out of the observer, right? So you, Negar, set up these programs, set up the site, or at least involved. How do you survey? I'm giving you an easy one there. Do you survey the employees? But how do you figure out what they're actually, it's like designing a new product that Apple makes. They have to figure out if people actually see the button or the button doesn't work.
Yeah, I think you have to have, I think universities get maybe a lot of flack about how much committee work we do, but in those types of situations, committees are really particularly helpful. And it gives you an opportunity also to figure out who are all your stakeholders, right? Do you have a committee committed to mental health and well-being, and does it have someone involved across all cross sections of your organization, right, from every level? So for us, it would be, are there students and grad students and faculty and staff and physicians? Are they all at the table? And so if we have an initiative that's not working, or we have a website that's not being used, we can understand why. And so I think it's similar to communication, but it's more about how are we communicating out? Is it clear and easy to find, so that you don't need an office like mine to also then help people navigate the resources that are already there? One of the problems some organizations have is not a lack of resources, but a low utilization of those resources. And I think
we got to measure that and change it, right? Because that's impact on people's lives. Yeah. Okay, awesome. So it's communication, ease of access. Maybe give me one more as we come up here as we finish.
I think the other thing that's probably much more salient now than it was pre-pandemic is, I think, employees' sense of expectation about how well their work life fits into their personal life has shifted a great deal. And so we see a much higher demand for flexibility and flexible work schedules, and an understanding on employees' part, because now we've experienced it, that actually helps my mental health. And so I think really, certainly there are some industries and some jobs where certain types of flexibilities are not possible, right? Like a nurse on a hospital floor can't work from home. But really thinking about, are we offering flexibility where we can, and understanding that it's not just a workplace productivity issue, it's a work-life balance issue for a lot of folks, and it really goes a long way to allow folks to feel empowered and feel like they own their own time again. And when people feel like their time is theirs, they do better at work. So I think that ability to be flexible, not just in schedules, but there's lots of different ways we can be flexible as well, like when you get your work done, right? Folks have really moved away from just accepting this traditional 8 to 5, and really feel like if I'm working remote, I can work whenever. I'd like to work whenever. And when we see them in departments that really embrace that, the most important thing is that the work's getting done. When and how it gets done is less relevant to us, keeping policies and procedures in mind, that we're respecting all those, that people feel gosh, my workplace respects my time, and that makes me feel excited and exuberant to do this work.
I think, Negar, you're really modern in your approach, and I think it's going to redound to the benefit of UCI and your consulting clients. So I'm glad to see that folks are thinking that way just already in 2023, and you're leading the charge there. Thank you so much for coming on. This is really wide ranging. We got through a lot in a short amount of time. Where can people find you? You can give us your website, your socials, and I'll also link them.
Sure. It would be at wellversity.com is my website, and then my social as well on Instagram is
Perfect.
Wellversity.
Wellversity. Awesome. Again, thank you so much. Thanks for coming on. Thanks for leading the charge on health. I will talk to you soon, and that was a great one today.
Thank you so much.